Hi, I'm Jess and I'm so happy to be here today with Liz, an optometrist from Optilase, and we are going to answer a few of your questions.
So Jess, you had surgery with ourselves a few months ago. How did you find it?
I did. So I was in about 6 months ago now. So it was 3 months before my wedding. So I was a bit apprehensive about getting it done so close to the time. But I got on so well with the surgery and I had no kind of side effects afterwards. I woke up the next day and I could see for the first time, which was just incredible.
Yeah, and
so it got on well.
Comfort-wise, were things good straight away? Did you find you to use lots of drops or things like that?
Yeah, so for the first week, I was really diligent with my drops.
Great.
I think it's something like 8 drops a day. So I was taking those into work with me and I made sure to kind of set reminders on my phone so that I kept up with that. So I didn't really get any kind of side effects. A bit of dry eye, but I had that pre-surgery anyway. And I didn't notice it got any worse or anything like that. So all very comfortable.
Great. And now 6 months on, any side effects or issues that you're having?
No,
things have settled down?
It's strange. I still, when I'm driving or if I go to the cinema, I'll reach for my glasses subconsciously sometimes. So it's just so nice to be free of them. But I don't have any kind of side effects, which is incredible.
Brilliant. And on the day, how was the experience? Did you find it easy? Were you worried?
So I was quite nervous going in, just because it's your eyes and, you know, you kind of, everyone had told me, relax. And I went in and I was just so nervous. But the nurse and the consultant really put me at ease. So I was in the waiting room and they made sure I was nice and relaxed before I went in for the surgery. But it was so much quicker than I thought and I didn't feel a thing. So the procedure itself was really fine, really manageable. And then I just went home and slept for the day. And then by the next day I was fine.
Brilliant. And you had your follow-ups then afterwards. And do you have any more follow-ups to go now?
So yeah, there was good amount of follow-ups. And I think at all of them they were educating me as well about how to protect my eyes. So I had one, I think, 24 hours afterwards, is that right? And then I had 3 monthly, and then I think I have to go back one more. Yeah. But yeah, I've gone to all my follow-ups and they've been all good.
Super, yeah. Usually we'd have one at 12 months just to make sure everything's stable and you're happy and that we're happy with how the outcome came out. So that's great.
So Liz, if you don't mind, I have a few questions that I got on Instagram, if you don't mind me asking them. Is that
of course, absolutely.
So the first one, what exactly is laser eye surgery and what does it entail?
Well, laser eye surgery is where we're reshaping your cornea so that you can see well in the distance. In most cases, it's short-sighted people who have problems with their distance vision, but we do actually correct people who are long-sighted and who have astigmatism as well. So basically, we're reshaping the cornea, giving you that lovely clear distance vision, and then the muscles inside your eye, they do your nice clear close work as normal as would usually happen.
So Liz, would you mind explaining the 2 different types of laser eye surgery?
Absolutely. The one that most people will probably have heard about is LASIK. This is where we create a little flap in the central part of the cornea. This just exposes the underneath layer where we're going to do the corrective laser. Once that's done, the flap is replaced, so it's put back exactly where it came from, and your own cells just bonded back onto your cornea. Within 48 hours, it's perfectly stable. The other type of surgery is called PRK or LASIK. This one just differs in how we get through the top layer of the cornea. We just soften the top layer of the cornea with a little bit of an alcohol solution, just to expose the underneath layer. But then again, we're doing exactly the same corrective laser underneath. This time, it just takes a couple of days extra to recover because we're waiting for a slightly larger patch of cells just to regrow. And while this happens, we do put a clear contact lens over the cornea just to give you some comfort when you're blinking and getting around your daily life and things like that. There are differences between the 2 and why we'd go for them, but during a consult we explain the reasons why one may be more suitable than the other, and that's what we go through with you in the consult.
So Liz, how long is the surgery from start to finish?
The surgery itself is very quick. You could be in and out of the surgery in about 20 minutes. On the day though, we do actually ask you to come in for about 2 hours because we're going to repeat scans before you go and then meet with the surgeon. He's going to do all your final checks before he brings you into the surgery, and then the nurse will also do some prep with you, putting in some anaesthetic in the eye. But the actual procedure itself, you could be, as I say, in the surgery for less than 20 minutes.
Yeah, I think my one was about 15.
Yeah.
But I was there for about an hour and a half in total.
Exactly. So, but I'd say it's not all surgery time. It's hopefully keeping you nice and calm and relaxed and getting ready and just making sure everything is absolutely perfect.
So Liz, how long after the surgery can you get back to normal activities?
Generally with LASIK, you're back to a lot of your normal activities after 48 hours. We do ask you just to wait for your first checkup so we can make sure that you're going to be legally driving and that things have proceeded properly. We do ask though that you avoid gym, swim, sauna or sort of dry, warm environments for the first 2 weeks, just so that you avoid rubbing the eye, causing yourself any discomfort. With PRK, it can take a few extra days to get back to that driving standard of vision, and also to be able to get about more comfortably, about 5 days. And then again, the 2 weeks for avoiding your gym, swim, sauna areas. And after that, back to normal pretty much.
So Liz, another question I got was, if you have regression, can you get it done a second time?
With Optilase, we do actually have a lifetime care policy. So yes, if there's regression in one or both eyes, absolutely come into us. We will do the exact same consult that we've done initially. So we need to make sure that everything is as stable as it was before, your vision, your cornea, and any issues with any dry eye. Once all those checks are perfect, then we can of course proceed and do any further surgery that's required to bring you back up to your 20/20 vision.
Okay, what is the average cost for laser eye surgery, and are there payment plans?
So yes, we do have payment plans, and there is also a 20% tax back that you should claim at the end of the year. Depending on your prescription, our price range is from $3,090 up to $3,990, and we will go through all price packages with you on the day of your consult.
What are the certain criteria that you need to meet to be eligible for laser eye surgery?
Well, we firstly have to make sure that your prescription is stable, so we'll be checking that on the day. We also take a lot of scans of your cornea, again, to make sure that that is stable and able for surgery. We do have a good check of the front part of your eye, any dry eye issues. If there are mild ones, we can help you clear them up in order to be suitable for surgery. If it's more chronic, it may be a bigger issue, and that can be actually one of the biggest causes for not being suitable for surgery. We do check obviously your family history of any eye diseases, and any previous medical history needs to be possibly checked out depending if you're taking medications.
Perfect. And then can people with astigmatism, can they get laser eye surgery?
Yeah, we do have parameters that you need to fit into, but most prescriptions will fit into laser vision correction parameters.
Great.
Yes.
Thanks. What happens if I move or sneeze during the procedure?
Everyone asks this question. During the procedure, the corrective laser actually has an iris recognition system. So firstly, it makes sure it's you underneath there. It also has an iris tracking system. So any little micro movements you make, even when you're perfectly still, you do make little tiny movements, they're all going to be tracked. Once those micro movements become bigger, that laser immediately shuts itself down. So even before you've thought about sneezing, it will have stopped.
So what do you need to do to prepare for the surgery?
If you do wear contact lenses, we do ask that they're out about 7 days prior to your surgery. Just make sure that you keep yourself well hydrated. On the day, we do ask you to avoid any caffeine, so tea, coffee and energy drinks. And also to avoid looking at things up too close on the day. So avoid using your phone too much, doing a lot of reading. We want you really looking out into the distance as much as possible on the day of surgery. But that's about it. Prior to surgery, we do also ask that you don't take any relaxing medications, just so we want you nice and comfortable, but in a relaxed sort of natural mode.
So is there an age cutoff for being able to have laser eye surgery?
The biggest changes that we find in people who are maybe over 40 is that they perhaps are now wearing a distance prescription and a reading prescription. Laser correction can really only correct your distance vision. So therefore you may be left needing a pair of reading glasses. There are options that you can go down, which include what we call an IOL, which is an intraocular lens. It's not a laser vision correction, it's actually a little lens that is put in front of your own lens. So a totally different type of procedure, but it can correct both your distance and your reading prescription at the same time. So more like a varifocal within the eye rather than a pair of glasses.
So what if people are really anxious on the day? How do you deal with that in the clinic?
We do try and prepare you really well for surgery, even before the day of surgery. Our clinics are always kept really calm, and we've great staff who are great at keeping you nice and calm, answering any questions which you may have, and of course just making sure that you're happy and looking forward to the surgery. We know surgery of any kind can be stressful, but we do our best to keep you nice and calm and make the experience as easy for you as possible.
So another question I got asked is, will I need reading glasses later in life?
Generally, yes. Anyone in their mid to late 40s will need a pair of reading glasses. So if you've had laser done in your 20s or you get it done in your 30s, you will eventually need a pair of reading glasses, just because the muscles inside the eyes are changing as normal as everyone else in their 40s are changing. But this is usually corrected by just a simple off-the-shelf pair of reading glasses.